Growing up, we have been taught that, okay, you're a female, you have to behave properly. If you have anger, just don't show your anger. A client comes to you and he's confused about the feeling. So how would you work with that person?
Deeper into this awareness, I will use different mediums. Can be art, can be writing, can be movement, can be internal breath, can be dialogue, voice. So I use different mediums to go deeper into the identification, the first part of the session.
Where people do not feel very comfortable when they meet, their friends, but they still behave in a certain way. They get jitters, they get extreme anxious, but they have to be out there.
An easy ways I can tell you can be very general, breath focused exercises, grounding exercises, walking, running, tapping, deep breaths.
So that subconsciously जो हम कर रहे हैं अपने बच्चों के साथ अपने आसपास एटमॉस्फेयर में, उसके लिए we should be, उसके लिए awareness रहे.
Our intentions might be caring, parents' intentions might be caring, but from the other side, let's talk about the child, might be taking it differently. Knowing each other's intention matters. So it's okay to sit and chat. It's okay to have this check-in time, listening time.
Hey, are you the smartest in the room or the topper in the class? Or maybe you have landed in your dream job, but still you're not happy, you're worried about your future, constantly thinking and overwhelmed. Well, intelligence and academics are just the piece of the puzzle. As the Gen Z say, Dululu is the Sululu, meaning just getting it out there or out of your mind solves most of the thing. Right? Hi, this is Dr. Deepika Krishna, a female health expert and a strategic health coach. Well, today I am here to help all the overwhelmed, overthinker and anxious high achievers to get some insights and some calmness in your life. So if you are one who is completely overwhelmed, overthinker, anxious, continuously thinking, if you're the one who is an ambitious go-getter but still are troubled with your thoughts and worries and your unnecessary fear, today is the topic for you. So today we have Sophia Ali, who is a psychotherapist, and she has been helping high achievers taking care of their unnecessary fear, thought and anxiousness. So let's bring Sophia Ali today. Hi Sophie, how are you?
I'm good, thank you. Thank you for having me here.
Okay, most welcome. In fact, in today's topic, we are going to decode the hacks and find out how to channelize your emotion, your thoughts and your behavior. Sophia, it's a very interesting topic, and off the screen we were discussing that how you have been helping so many people, channelize through all their fear and anxiousness. In fact, the topic which is about your emotion, your thoughts and your behavior, I feel all these three are also interconnected. I really feel that, first you get that thought, right? Or maybe that emotion which arises first, and the emotion makes the thought, and with that thought you do some action which considers to be your behavior. Is that so? What do you have to say about today's topic?
So when we talk about human body, what I sense first is physical. The moment I said I sense, it's physical. What is happening inside my body? Then going into emotion, feelings, tired, happy, irritated, or frustrated, joyful, can be multiple feelings related to maybe sensation, and then thoughts can be, okay, I wanted to do this, or I was not able to achieve that. That's a thought, a particular thought about that situation. Now with each person, it might be different because each one of us is different and unique in its own way. So some people might give importance to one particular level. So these three are called 3 levels of awareness. Yeah. Some people might give more importance to thought than emotion. Some might be giving more importance to emotion than physical sensation, whereas the other aspect to it is some might just go with, okay, this is what I'm sensing right now. Or there will be blend of it. So it totally depends on person to person what they're experiencing and how they're experiencing, depending on where they are in the situation.
Yeah, so what I understood that, okay, emotion, behavior, so emotion, your thoughts and behavior, right? And when you work with your clients, you check the behavior and then you work on the thought and then you work on the emotion, or all the three things are differently worked, like how it is.
So I go with the need of the client. So what is present? What is present right now? What is calling for attention, or what is seeking attention of that particular person? So for me as a therapist, it's very important to listen where my client is coming from. So here it can be sensation, it can be thoughts, it can be emotions, and then the behavior that they notice. Sometimes other people notice the behavior. So when we talk about behavior, so physical, emotional, mental can be very personalized, can be what I am experiencing inside my body.
Correct.
Whereas behavior can be, okay, I can see it, but sometimes I'm not able to capture it, and other people are telling, maybe my family member noticing and capturing and letting me know that, okay, this is what is happening. Or maybe it will take some time to go deeper into the awareness.
Yeah, I really like you. I really appreciate you saying that, how family notices, when these symptoms arrive, or when there is a sequence of any kind of behavior or emotion or thought. I think that is why it is so important for the family and the friends to intervene if somebody is continuously doing certain kind of thing. I think it's important for them to bring it out there and to talk about that, right? Because we discussed that Delulu is the Sululu. So I think, rather than keeping it in your mind or just behaving in a certain way, one should talk about this. So that brings me to my, next question, which I wanted to know, that what are some common bad habits emotionally which people develop over the years while growing up? Let's say a child which is a complete, filled with so much of love, have so much of trust, everyone, whoever is picking the child up, and now gradually as the child turns into adult or goes into school, turns into adult, does their job, and likewise the emotion and the mental health, everything keeps on changing. So what are the common bad habits which we emotionally develop unknowingly?
When we talk about unhealthy habits, particularly emotional based, then I think so it depends on experience. It depends on how individual is experiencing the situation, the what is happening around, how the environment is, where the person is going. So I guess in this particular question, the situation matters a lot. And the way the person, the way the individual handle the emotion. Or even like also question, the question comes in, do I know what emotion I'm sensing? So unhealthy emotion would occur way back. First, I need to know that, okay, I am experiencing this emotion. Am I aware this is what I'm experiencing? Am I aware this is what is happening inside my body when I experience this particular emotion? So it becomes unhealthy. But before that, I need to know what is happening. I need to know that this is emotion and this particular emotion is giving me this sensation. Now, this again brings me to the first conversation we had when we started, physical, emotional, mental. If I separate it, if I am going deeper with each level, I am able to gain more awareness about myself.
Sophia, how strange world we live in, that, we are not emotionally aware of, our feelings. Although one reason can be that we don't talk about it. There's no education which been happening in school, colleges, that, okay, this is also a very, very important factor. Chalo, food or nutrition ki ab baat hone lagi hai. But still, mental health is now, catching up very, very strongly. People are talking about it. Emotional health, which eventually develops that mental, illness or mental incapability, or, mentally upset feeling, that is so much important. And like you said, कि अपने emotions को लेके aware होना, to know कि अच्छा मेरे को ये feel हो रहा है, I'm feeling sad. There is a reason which I'm feeling sad. Is this sadness? Is this anger? And also expressing that emotion.
Yeah.
I think, growing up, we have been taught that, okay, you're a female, you have to behave properly.
Yeah.
If you have anger, just don't show your anger. So many times in cartoon series, they show that, okay, mom is getting angry, she goes in the bathroom, she screams in the bathroom, beats some stuffed toy and then come out very soberly, nicely. So, these kind of thoughts, these kind of ideation has been placed, whether it is for men, they have to be strong, they can't cry, they, cannot show their tears. I think such prejudiced thought has also made us very, very put us in a very, very challenging situation where we don't know that whether it is sad, happiness, anger, frustration, what is the emotion, right? So how your client, how do you channelize? Like, let's say a client comes to you and he's confused about the feeling. Maybe he is a professional, entrepreneur who is developing something, but still very confused and feels unknown scare, unknown fear. So how would you work with that person? Like, what would you what would be your first action?
First action would be nothing. It would be I would be listening to my client.
Yeah.
The approach I use is movement-based expressive arts therapy approach. So when we talk about that approach, there is a sense of, okay, I am working with myself as a therapist as well. So there is this intuitive sense that I have of just pausing and listening and then going into gentle transition of identifying what is happening, which level my client is at, then going deeper into exploring those levels. Wow. So when I talk about the approach then says that, okay, our body holds memory, information. So each and every situation experience, our body is holding in.
Yeah.
And through, so if I have to go deeper into this awareness, I will use different mediums. Can be art, can be writing, can be movement, can be internal breath, can be dialogue, voice. So I use different mediums to go deeper into the identification, the first part of the session, to explore where we are.
Okay.
To explore and identify, maybe you can say challenges, to identify challenges, or to identify why, some of the why questions the client is experiencing. So the flow depends completely on the client, and it depends on how the client is responding to different mediums.
Yeah. Okay. So there's some tools, some dance tools, some movement tools which you use to discover the level of emotion quotient, right?
So not exactly dance move, but it's more like, so for example, I will, so we'll do this, just do this and this.
Okay.
Do this with me, this and this. So what is coming in your mind when you extend your arms? What word?
Right now I'm in a very positive thought. That's why I'm feeling I accept all the love and all the positivity to me only.
Okay, and then when you do this, you do this with force,
I push out all my negativity.
Okay, so here the theme that was present, like I did it very briefly. When I'm in a session, I'm doing it very in a detailed manner. So here, pushing away, coming to yourself, taking in, accepting. So, just this movement can bring pushing away as a very intense theme.
Yeah.
And then accepting, love, hope, coming together. So see the gesture just like this.
Yeah.
So it can be like this movement. So it's not about a proper structured dance. It can be more of saying something about the theme. Pushing away, letting go, coming to yourself, observing, holding on, releasing. Can be multiple themes that we can work on. Standing on, walking towards, leaving behind.
Oh wow.
So different themes,
I
exploration.
just
and
loved it. It is like non-verbal communication with yourself and the universe. It's just with your action and your emotion, which is flowing by your arms and legs and your movement and your thoughts, right? I just loved it. It is brilliant,
I can sense it.
Yeah, yeah, I
I'm
know,
like,
I know.
okay.
Automatically I'm absorbing all the positive radiations here from you. Well, coming back to our question that how, how the society has made up, that how, how we have to behave, how we have to, be in a certain way, behave in a certain way. I remember, one of our client, like I have cancer hospitals and we do work with a lot of cancer patients. So the patient was around 42 years and was having breast cancer. So when we looked at the history of the patient, like going back right from the childhood, I mean, initially she said, okay, her child was beautiful. There was nothing, it was absolutely spectacular the way it should be. I'm like, okay, what do you mean the way it should be? Like, okay, you grow up. They had, siblings which were boys. So, the boys were getting a lot of attention. They were, parents were taking care of the boys, and the girl was supposed to do things which, automatically the family believed that ye to karegi. And then the relatives and everyone ki acha ye, kali hai zyada, kaise hoga iska shadi, kaise hoga, malai lagao, besan lagao, wo sort of thing uska bachpan raha hai, right? So for her it's natural, it's normal, right? And then, she goes to the school where, she's a good performer, but the teacher, just because of the way she looks or she, she perform, I mean, teacher usko piche kar deti hai. Like, you're not the front one, you just go behind, right? So that, of course, it leaves some kind, it's an emotion, emotional thing. It's a tragic thing for a child, for a 6-7-year-old child. It's definitely a tragic thing. So going on, uska journey was like this only. Wherever she wants to perform, she wants to come up to the stage, speak, but the whoever is leading the show, unhone usko piche kar diya. And she assumed, okay, that's how she's supposed to be, right? And then the teachers, who teach you various things, who are, sometimes biased, sometimes, even with your academics, like we were talking that how academics and emotions are not connected, but it is connected when it comes to, school and growing up and things like that, right? And then later, of course, she got married, which she feels very privileged about, wherever she's married, So she feels extremely privileged that the husband is loving and the husband is giving her opportunity to work, to, explore her, go and explore the world while she's also handling the child and all the kids, which I think most of the moms, we are, girls are superhuman. We do manage a lot of things. And now, there are relations. She's been handling her, husband side family, her side family, and so much of relatives with different kind of situations, which she feels that it is okay. Main nahi karungi to kaun karega? That kind of feeling. But eventually, I feel that all these things are a kind of a suppression or repression of your emotion. I mean, I don't know if a child jisko ekdam se teacher achhi performer ho, usko piche kar de, she wouldn't feel hurt. Right? I don't know if, a girl like her who is so well educated, very, highly qualified, jisko permission diya jata hai kaam karne ke liye, she won't feel emotionally hurt. I think all these things have repress and suppress the emotions, right? And in cancer also, now we know that so much of suppressed emotion, stress, come up in various forms to your physical body, right? So I think emotion is so deeply rooted to your health, and like you said, we tend to forget it. We tend to not pay attention. जबकि मुझे लगता है this is the very, very important thing which each and every child should be taught at school. I mean, I think your course should be happening right from the class, KG or nursery, right? Don't you think like that?
Yeah, I think so. It's very important to unlearn and then learn.
Yeah.
Unlearn some of the things that makes you feel sad, that why I'm here. Why? Questioning like, okay, I should not be here. Should. I need to do this. My parents told me to sit like this. I'm a girl, I'm a boy, I should act like this, I should talk like this. This is the way I should be. It's very important to know who I am actually. The authentic self. It's very important to explore that authentic self. And it is only explored when you feel safe, when you feel that it's okay to be the way I am. And from the other side, acceptance. Can be acceptance from the parents, teachers.
Yeah, yeah.
I can tell you about my own childhood where teachers were not that accepting. They were guiding. I won't say that,
Yeah,
there was
correct.
no guidance. Yes, I am here because of each and every person who has helped me in my journey. I do thank them. But then at the same time, it's very important the teachers were in a different way guiding.
Yeah.
You should stand out because you did not do your homework. Example.
Oh my God, those were the scary days, man. Oh,
Yes,
thank God it's over.
Thank God it's over. And still I'm working with few teenagers where they do talk about that, okay, I want to be in that gang that talks about latest things. Even though she connects with someone who's just reading a book sitting in the corner. But because of peer pressure, I will stay with that gang. So that knowing that my identity, where I belong, where I need to be or where I feel I need to be, my own wants, my own needs is important. That exploration takes time. And that exploration can be done going into therapy. And it's okay to just go into therapy the way you go to anybody, like any other doctor.
Yeah. In fact, Sophia, I mean, you spoke about how we adjust ourselves because we are, a community, we want to be accepted everywhere. That brings me to social pressure, which is also a thing in today's, it was always a thing, where people do not feel very comfortable when they meet, their friends, but they still behave in a certain way. They get jitters, they get extreme anxious, but they have to be out there, right? Maybe the work demands, maybe the, friends and family demands. So how can one channelize that kind of emotion? Let's talk about this emotion in particular. A person who is introvert, I won't say, because I believe that, personalities change. A person who likes to, sit with a book at one side, but the work demands him to go and meet and do interactions with various people. So how does one can come out and do that, and how can one handle that kind of emotion?
So first aspect of it is willingness to work towards it. And if I enjoy my space, being alone, sitting alone and reading a book, it's fine. But if I am willing to work on it, I am willing to step out to explore other aspect of my own self, then why not? So yes, awareness plays a very important role. Bringing in more focus. Okay, if I am talking to someone and if there is this palpitation or some sensation, vibration or feeling, okay, I don't want to stand here, and constant moving of body and knowing that, okay, something is happening inside the body, acknowledging that, working with it, going to a professional. If I am not aware, so quick and easy ways I can tell you can be very general. Breath focused exercises, grounding exercises, walking, running, tapping, deep breaths, just acknowledging where that emotion is coming from, tapping that body part, staying with that body part, just gesture of like, okay, maybe I need love today, and maybe sitting with it. So some of these grounding exercises can be done. Whereas if you find that, I don't know, I don't think so it's working for me, there is no direction right now, then it's important to go to a professional. There are different therapists. There are expressive art therapists, music therapists, drama therapists. I am registered somatic movement therapist. So like this, there are other aspect of therapy that is opening, approach is opening. So you can go to the therapist you connect with, and you can find your own self. You can explore your own self in a different way. Let's say shade of myself, like different shades of me. And it's okay. One shade of me talks about, I like being alone. And the other shade of me talks about, I like being with the community, exploring, exchanging, acknowledging each other, talking. But also I know that, okay, is it taking my energy too much? So let me step back and let me come back to my space. Let me go there and exchange energy. So acknowledging that energy that you carry inside and the different sense of yourself you carry and when to use that self. becomes okay, part of awareness. That okay, I have choice, and it's very important to accept who you are, and then also accept that you have choice. I have choice to sit here, I have choice to walk outside and just be there.
Yeah.
So that choice brings a very important role in one's life. That okay, I have choices to do the way I would like to do.
Yeah. Lovely. And I have choice to choose the therapies. I have choice to take a day off if I'm not feeling, so well emotionally. I think that's also a thing. Now, you spoke about so many therapies, right? Is it difficult for a person, like how a person choose that, okay, what kind of therapy should I go for? Because a lot of therapies like the one you are doing is very, very new for our society, which is already been laid back on mental health. So how does one, where does one go to find out, okay, which one is working for me? Like, how do I find it?
By experiencing. You cannot, there's no shortcuts here, there's no magic, even in the therapy I'm doing. It might take time, but what will help you with your decision is experiencing and being with other therapies or just exploring.
तो सबको फीस देनी पड़ेगी and the therapy is pretty expensive. So
Therapists are doing workshops.
Okay.
So you can just attend workshops, and if you connect with the facilitation skills or the way the therapist is facilitating, so that plays a very important role. How the therapist holding the space.
yeah.
So when I was in college, I tried different workshops, and that workshop only gave me light towards this path. That okay, I can explore dance therapy. After doing dance therapy, movement therapy, and then exploring furthermore, attending conferences, I got to know, okay, I would like to go deeper into it. Then I worked for a while. And after working with children, I wanted to explore expressive arts. So I applied for expressive art therapy course. And that's how I found my way.
Whatever you're doing, it's sounding pretty fascinating, although I have seen some of your workshops which are spectacular. So I think the easiest way for everyone out there who are thinking, hamare ko therapy karani chahiye, nahi karani chahiye, and, should we pay the therapist so much or not? Probably you can attend one of the workshop to any of your choices of therapists, see that how they are working, how they are holding up the space. And if you connect with them, definitely, I think that's how you can make the choice. You can narrow down your path much more better. I feel that, because I also would have done that. So, Sophia, I would really take this opportunity to ask you one more thing. My son, I have 2 kids. So the elder one is doing very good in school. He's socially very well connected, doing wonderful with his academics and things. The younger one is also doing very good in academics. He's also very socially, well connected and doing his things. But still he feels that, I have to match up to Bhaiya. I have to do what Bhaiya is doing. So he has his different personality. He talks about geography, he talks about, world politics and various other interests. And my elder one, he has his own interest like fashion and things and all. And of course, I mean, today's Insta thing, because the game of, looks is so perfect with everyone that people talk about fashion and they get more interested towards that topic, hence a lot of attention goes when, people talk about makeup, fashion and patla kaise hona and things like that. But on the other hand, geography and world politics and economics is a little boring, particularly for the kids at that age. So he comes up to me, Mama, that I don't know what to do, because everyone is so fond of Bhaiya. I do have my friends, I'm very happy, but I feel that you want me to make more friends. Listen, I don't know why you're thinking this, but I never told you that. Then he comes and says, no, Mama, आप ही तो कहते हो कि और अपने friends घर पे लेके आओ, और ज़्यादा friends लेके आओ. I have a set of friends, Mama, I can get them. So I think unknowingly, as a mother, I have created this, I have given this vibe maybe that I want you to see like, what Bhaiya is doing. And I think at this situation, the parents also need counseling. Yeah, they also need therapy. So that subconsciously जो हम कर रहे हैं अपने बच्चों के साथ अपने आसपास एटमॉस्फेयर में, उसके लिए we should be, उसके लिए awareness रहे. Isn't it? Do you get parents coming up and talking like this situations? Okay, I'm doing this, I got to know. Now what should I do? How should I rectify? Or you tell me how should I rectify now?
But that's very important. I would like to appreciate that you were talking about it.
Yeah.
And he was sharing that, okay, this is what happened. And then you're like, oh, no, that was not what I meant.
Yeah.
So now that's important. Our intentions might be caring. Parents' intentions might be caring. But from the other side, let's talk about the child. Might be taking it differently. Might be taking it, oh, what's happening?
Yeah.
No, is she instructing me? She wants me to do that, or this is the way I should do. This is the way people should be, or this is the way people should behave.
Yeah.
So that check-in gave that window to talk about that. Okay, no, this was not my intention. So not just parent-child relationship, it's with also husband-wife, friends, intentions, misunderstandings, not talking about it, or giving too much guidance. Or I'm using a very gentle term, can be too much direction. Do this.
Teaching too much of teaching.
Yeah.
Now
No, you have to do this.
Yeah, no,
तुमने
I know.
गलती कर दी, अब ऐसे करो. So
Yeah.
that's very important, that knowing each other's intention matters. So it's okay to sit and chat. It's okay to have this check-in time, listening time. So as a mother, today what I will do, just deciding that, okay, as a mother, today what I will do, I will just listen.
Yeah.
No reaction. I will just listen. And if the response is coming, I'll check in. Can I respond now? And it's okay to ask like that. It's okay. Even if I am a mother or a father or a husband or wife, I can ask. Can I talk now? Can I share? Do you want me to listen? I talked about it before as well.
Yeah.
This aspect plays a very important role to understand where the child is. Yes, the parents are coming to me that, okay, I don't like this, Sophia. Sophia, I don't like, she comes at home and she's aggressive and she's like, I don't want to do this. I don't know how to handle that sometimes. So that's like, if you are able to communicate the intentions and also sitting together the way you do it with anyone else, like with friends, we sit and talk. Maybe it's all about gadget nowadays, but also telling that, okay, we need to let go of that right now. Let's just talk. Let's just exchange gestures. Let's just look at each other. Let's just notice, be there. Maybe also be there in silence.
Yeah.
It's not forceful to, oh, I have to talk. Oh my God, I don't have my phone, so I have to talk. Not like that. Oh, we can play games together. So a beautiful way with child to communicate is through games. Through games, walking together, acknowledging, okay, and then having those fun, exchanging games where there is no direction, but also openness and freedom to explore and expand oneself. It's important. If I know this is contracted, I should also know this is expanded. So in situations like these, if I'm giving both environment, the child will feel safe to even express something that is happening inside. Even if it's fear, even if it's scared feeling, the child will express, because you have provided that safe environment to that child to expand the arms, and not like, okay, you always have to sit like this. So I'm talking about expansion, metaphorically, and contraction. That's like more of, I want to feel there. So that's what I was talking
Nice.
about.
I think, be a child with your child, and probably don't consider your child. Consider your child as a human being rather than your own property. I think that's also very important for all the parents out there. I'm also learning that. But anyways, that's a lovely session. You gave us so much of insightful on our emotion quotient, and so much of negligence which happened during our growing up periods. It's lovely. Is there something which you want to tell to our audience, which maybe one thing which really is very helpful for them?
Yes, I would like to conclude that treat every experience as a resource in your body. And that's how Anna Halpern used to talk about, that every experience that you had in your life is a resource in your body. So treat it as a resource than pushing it away. maybe there is something the experience is talking about. Maybe there is something that the experience is guiding you towards.
So intrusive negative thoughts, which just comes out of nowhere. How harmful is that, and why do people get this?
When we talk about thoughts, it's just I'm thinking about it, and it's coming again and again because I've been just thinking about it. And the more attention I'm giving to my thoughts, it will increase. So remember the level I was talking about? Now this part is the mental body.
Yeah.
The mental body creating that fuss. The level and the intensity is increased because I'm focusing on that particular mental process.
And whatever you put your energy on grows.
Yeah. So like you said, it will grow.
Yeah.
So how we can do it is shifting your mode of level. If we have to just talk in more general way, that shifting your mode of level can be shifting to physical. So more of physical grounding is what I feel is very much important when we talk about repetitive negative thoughts.
Correct.
And it's challenging thoughts. I would rather say challenging thoughts when it's not helping me, when it's just pushing me down. And the more down I'm going, not in terms of that I'm able to touch the ground, still I'm feeling I'm not able to feel the ground.
Yeah, but Sophia, just negative thoughts randomly बैठे हैं. चलो, let's say मैं इधर बैठी हूँ and I feel sudden, what will I do अगर earthquake आ गया तो, what will I do? Or maybe अगर earthquake आ गया, so how would I take care of my kids? Or randomly, what if tomorrow I get up and, the sun falls on me? Like, very, very random negative thoughts. And we do have, these kinds of insecurities, the subconscious insecurities, which sometimes come up on the surface. How can one tackle those?
Individually, it might be depending on the experience they had since childhood, maybe college days or interaction with someone. General way, I would say that coming back to your 5 senses, grounding yourself, grounding exercises would help you to shift your attention from thoughts to your physical body. And eventually, yes, you can also explore emotional body, but right now, since thoughts are at peak, and I want to come to the present moment. So it's more important that maybe I'll use my senses, maybe I'll look around, maybe I'll talk to someone that I connect with. More of present moment talks would bring me back to the present. And if I am consistent with these practices, the thoughts will very gently, slowly fade away. But yes, consistency matters.
So you spoke about 5 senses. One of the 5 senses, I don't know whether it is grounding exercise or not, that being in a present is that आप अपने 5 senses को feel करो. Like if you're lost, if you're worried, just calm down and see what are you watching around. Their birds, their colors, what colors are they, and then what is the flavor of which you're feeling in your mouth. How's your skin feeling? What is the tactile feeling? And likewise, that आपको क्या सुनाई दे रहा है, bird की आवाज. Basically, being present on all the 5 senses. So, what is grounding? Can you give our audience some, or maybe you can give an example of any kind of grounding exercise which is easier to do for the people who are, getting angry or anxious at any point?
So when I talk about grounding means coming to the present moment, coming to here and now, right now. And one of the practice that I do on daily basis is tapping. So just like starting your tapping from head, going back of your head, going to your chest, your arms, your face, gentle with your face, under your eyes. I'm just doing it very gently, but
it already feels good to me.
And then your stomach, and then this. And if any sound is coming up, just going along with the sound. And then tapping your face, and then all the way down to your toes. So this is one of the ways that I use to come back to my senses.
So, one is negative thought, and there's other kind of emotion which is anger, which a lot of people don't know how to handle. And कहा भी जाता है कि ठीक है, जब आप एंगर हो तो थोड़ा एंगर दिखा भी दो, बट देयर इज अ लेवल कि आप कितना एंगर दिखाओ, कितने टाइम के दिखाओ. यू कैन नॉट बी एंग्री फॉर एवर, जस्ट शाउटिंग एंड बीइंग मेकिंग द होल एटमॉस्फेयर बैड. So how does people manage अगर उन्हें बहुत extreme गुस्सा आता है, right? एक बचपन से सुनते आते हैं जो हमारे पेरेंट्स कहते हैं गुस्सा ज़्यादा आ रहा है तो breathe and count 1 to 10. Does that work or is there any other thing?
Yes, that works for some people. I would say there are many and plenty of exercises that we have, and people do follow, practice since ages.
Yeah.
So the one you connect with, just practice. For me, it's very important for my, like if I am working with someone or if I'm just talking to my mother and if she wants to talk to me about it, then it's more like, okay, just do it what connects with you. Call that, okay, that this is the thing I connect with, or this is what I would like to do with. So when anger is there, like I have noticed anger everywhere. Even so I just like driving. Okay, let's just talk about driving.
Yeah,
okay?
that's the main one. That's the main one.
Driving and anger, I feel they're interconnected. When I notice people around, so I am following all the rules, I'm going, and then suddenly there is a person who is like, he is cutting my way, and I'm like, oh my god, what?
Yeah.
So now what I do is I try to bring more patience. I'm like, okay, let him go. He might want to go first. Let it be. And I just, okay, I'll tell myself, Sophia, let's just stay there. Let's breathe. So I do, and then I'm like, okay, let's go with it. I try to notice that. And because of the way I am driving, it after when I get out of my car, I notice there is shifts. If I'm angry, I'm noticing that it's in my body. If I'm irritated, someone did this. If I'm frustrated, it's like inside my body. And why I'm carrying inside my body? I'm harming myself. So anger is not harming you. It's harming me first. And then maybe if you're interconnected, if you're my very closest person, you will get affected. The family will get affected. But the first person who is affected is me.
Yeah.
So if I know it's affecting me, my health, and then also the energy is going around in my family, I would take some step towards it. And those steps would be depending on your connection. Tapping might help. Shaking your body, breathing might help. Walking might help. Pausing might help. So I created a very small, like a check-in for myself. So when I feel that there is this anger in me, so what happens is I feel it here in my chest. So when I feel it in my chest, I'll pause. I'll pause. I'll take 4 deep breaths. I'll just distance myself from that situation for that particular time. And if I want to address that situation, I'll address it later. Now this practice, I'm still doing it. I'm still reminding myself. I'm still talking to myself to pause. And it's very important. Even if I'm a therapist, that doesn't mean we are human.
Absolutely.
We do experience emotion.
Yeah.
And each and every emotion is important. Even anger is important. It's okay to be angry. But in what ways I am getting that anger? Let me use that anger, use that energy. So all the intense, like anger, you talk about frustration, anger, like angry, or all the intense emotion, you can sense it in your body.
You know, they say that maturity comes with age. I mean, of course, I think, and also, you know, I really like your concept when you said that, okay, just pause for a minute. For me, it's a combination of both. I mean, the way I handle my emotion is, of course, through all the learnings and through as I grew older, but also through your concept, because I read a book which was Emotional Health or Breaking the Habit of Being Yourself. I mean, something, I think this is the book's name, which said the exactly same thing. Just take a pause, before you take an action. It can be anything, even if you want to make, don't go very harsh and rushy towards anything, or just even if you want to reply somebody something, just take a pause and then do that. And interestingly, that book also said that note down your emotions and when these things arrive. Like, what is the situation when they arrive? For an example, if you have been to, any loss, right? And you go back to that situation again, your same feelings come back. or if you had kind of been any crisis or any bad situation, if you go back to that situation, that particular people, or that particular scenario, the same emotions come back again. So there are ways and means to handle yourself in that particular situation. The book also says that, okay, just be very brief about your emotion, that when are they arriving, how are you going to take action on those emotions, what are you going to do differently. And the interesting topic, the book is also very interesting, how breaking the habit of being yourself. So it's like being ourselves. What we would do, किसी पे गुस्सा आया या गाड़ी कोई क्रॉस की, I'm also going to win, or I'm going to leave them behind. That's a spontaneous action. That's what we do. But breaking the habit of what we do to get more emotionally enlightened, mentally enlightened, is what you gave us some insights of that. That's lovely. I love that.
Yeah, talking about books, even Zen, The Art of Simple Living, Japanese philosophy, they talk about sense of simple living.
Yeah.
If I'm drinking coffee, the taste, the senses involved, the cooking, okay. The happiness, the sense of being involved there. Cleaning the house is more like you're creating space in your mind.
Decluttering yourself.
Yeah. So it's beautifully different exercises or practices that unfold your own way of being.
Yes. And more importantly, I'm sure when people listen to this podcast, we will get into this mode, okay, let's just focus on ourselves, let's focus on our emotion. But the most important thing is to do it repetitively. Because आपने वो सुना, उस समय आपको लगेगा ठीक है, like we listen to diet food, then instantly हमें लगता है आज तो मैं यही करूँगी. But कितने लंबे टाइम तक आप कर सकते हो, that's important. And like you being a therapist, practicing on your own, on yourself since years together now you know, okay, you're going to behave like this. It is really important to keep doing it rather than just कि आज मैं ये करूँगी और कल मैं भूल जाऊँगी, आज तो छोड़ो, I'm going to fight to that person. I think it's very, very difficult to do.
And you can be gentle with yourself.
Yeah.
Okay, today I don't have 10 minutes to do the same ritual. Let me do it for 5 minutes. But if I'm doing it every single day, I'm consistent. Now that makes different rather than, oh, I don't have 10 minutes, I will not do it. Let me just skip it. So maybe 5 minutes will hold some space. 3 minutes will hold some space. Even thinking about it intentionally holds some space.
That's being disciplined. That should be a separate podcast altogether. Well, thank you so much, everyone. I hope you got the maximum input out of today's podcast. And if you have any question, you can write down to us, email us, or in fact, click on the link below and find more resources on that. Thank you so much. Have a great day.